Hello, welcome. It's me, the MA mentor. I am going to talk a little bit about phlebotomy today. So we will go ahead and get started. Just so you're aware, there will be a follow-up video that will be in the instructional skills playlist that will actually demonstrate all that I'm about to talk about today. So, phlebotomy, the art of drawing blood is what I call it. Let's go ahead and just dive right in, shall we? So there are various phlebotomy methods. We call it venipuncture methods, right? Um, there are the vacuum tube method, which is probably the most commonly used. It's fast, it's convenient. The supplies required aren't horribly complicated. So, and many of the facilities have all of this on hand. What you need for the vacuum tube method is this little guy right here, which is called, most people call it a hub. I learned a long time ago when trying to order them, that is not their technical term. You'll see that a lot in medicine. We'll call things one thing and they're actually called something else. But they are known as a single-use needle holder. Okay, so that is that. Here's your needle right here. As you notice, and I love that I was able to find this picture. This is what it looks like coming out of the package right here with the caps on both ends. When you go to pull the caps off, you want to pull the what I call the clear or the white cap off first. It covers this end here, which that is a needle, that dark kind of, it looks rubber. Don't be fooled. There is a needle underneath there, but it is covered in rubber. That's what actually penetrates the tube. But be careful when you're opening these because if you grab this end and grab this, if you grab just both ends and you pull, inevitably the end with the bare needle always comes off first. So I always try to hold right in the center. So right here where the safety device is attached, and then pull the clear or white end off first. The other end will be various colors based on the size of the needle, the gauge of the needle. So I know for certain green is a 21 gauge, black is a 22 or 23, I believe. So you'll see that it'll be on the package as well, what size they are. So that actually attaches once you've pulled this end off. You actually go ahead and thread this right into here. Just screw it onto there. And then that's really all you need, other than the tube, and we'll talk about the tubes a little later on. For the butterfly tube method, this is your butterfly needle here. And if you'll notice right here at the end, this actually has two different ways you can use it. And there's an adapter. This piece here, very similar to the piece on the regular vacutainer needle, where that is a needle underneath that rubber, again, to puncture the tube. But this, if you use it wholly like this, you can screw this right onto a hub, just like you do a regular needle. And you can use it that way by pushing the tubes off and on in order to collect the blood. Or you can actually pull this device off and go ahead and put that in the sharps container because it does contain a needle. And then this piece will actually screw on to a syringe, which brings me to the butterfly syringe method. And then you can actually just pull the blood out yourself using the syringe. Now, why would you use one over the other? Well, usually you use a butterfly needle when you have smaller veins, more fragile veins, areas where there isn't as much tissue necessarily around the vein, like in the arm. Children, we use them on a lot, the elderly. Now, when would you use the syringe over the vacutainer? Well, the syringe allows you to have more control over how fast that blood comes out. So in children or the elderly or in the back of the hand, especially if you have more fragile veins, you'll want to use a syringe because then you can control how fast the blood is coming out of the vein, keeping it from collapsing on itself. If you just pop that tube on, that tube, it's called a vacuum tube for a reason. It actually contains a vacuum inside, not like it has a vacuum like you do with your, but it has air in it that creates a vacuum, or lack of air rather. And when you pop that tube on, and this part right here is penetrated by either this or this, that vacuum then allows the blood to be sucked into the tube. You have no control over how fast that happens. So usually you'll use the butterfly tube on smaller veins, but usually like in the antecubital, where they're not tiny, tiny. And you'll use a syringe on very fragile veins, like in the back of the hand or in the elderly or children. All right, moving on, there are other supplies you're going to need to gather before you draw blood, and that is a tourniquet, alcohol prep pads, 2x2 gauze, some gloves, of course, and then paper tape or Coban. Coban is actually stands for, I think it's cohesive bandage, um, but that's the stretchy stuff that kind of wraps around and sticks to itself. And then paper tape is just paper tape, like medical tape. Um, that most places, especially labs that draw blood regularly, use all Coban, because then they don't have to worry about it. The reason you would use Coban over paper tape if you have both is that some people are very sensitive or even allergic to the adhesive on the tape. So then you would want to ask, of course, before you use that, if they have any sensitivity or allergy to that. Um, but again, many places just use Coban just to eliminate that whole problem. It is a little more expensive than the paper tape, but it is what it is. Um, Tourniquets are rubber, they're stretchy, they are single use. So when you use a tourniquet on a patient, you only use it once. Well, you can use it on the same patient over and over, but you don't use it again on another patient. You just throw those away once they are used. The alcohol prep pad, of course, 70% isopropyl alcohol. That's used to clean the area before actually inserting the needle. And then the 2x2 gauze is used to put pressure on the site after the needle is removed to stop the bleeding. It is also put down underneath either the tape or the Coban to use as kind of a pressure dressing for when the patient leaves. And then, of course, gloves are PPE for us. Now, some clinics, labs, some areas do require more PPE be used. So you just follow your policy, like gowns or lab coats or things like that. All right, if you haven't before seen my videos and you like them, please do drop a like on this video. I really appreciate it. And if you're not yet subscribed to the channel, please do subscribe. It really helps me out. So let's talk about veins now and site selection. We're going to talk about the steps here in a minute, but let's take a look at these veins. We usually want to look at the veins in the antecubital, and the antecubital is the bend of the elbow, the inside bend of the elbow. I used to call it the elbow pit when I was a child. It's the easiest to locate veins in most patients. The veins that are in that area generally have a wider lumen, and the lumen is just the opening of the vein, which makes it easier to get the needle into successfully. They're usually closer to the surface of the skin there. Those veins usually have thicker walls, and that area is just a little less sensitive because there's not as many free nerve endings in that area. Now, notice I said usually a lot. Everybody is different. Every vein is going to be different. They're all going to be located basically in the same area, but different. So when I say things like usually they're closer to the surface of the skin, well, in many cases they are, but for some people they're very deep in that area. Usually they have a wider lumen. Well, yeah, because of the size of the vein, but some people just have very small veins. So this is where we look first because of that. Now, there are different veins in this area, and you have what's called the median cubital vein, which is this guy right here. Okay. That's the first one, and I have them numbered in the order in which you want to go after them, basically. So that would be your first choice because it's right in the center. It's not near anything else that's kind of detrimental. Um, and it's usually, again, usually easier to find. Then you have the median cephalic and the cephalic vein, which are right here. That would be kind of your number two go-to. The cephalic, a lot of people do have, and I call it the thumb side. So if you've got, anatomical position, palm to the sky, the thumb side is where you would find your cephalic vein. A lot of people do really have good veins on that kind of outer lateral side of their arm. And then there's the basilic vein. The basilic is kind of like the last resort, primarily because the basilic is on the pinky side of the inner arm, and it's very, very close then to the brachial artery. And you wouldn't want to accidentally hit the artery. Two reasons. It's very painful. And secondly, um, there are those that draw blood from arteries, usually like respiratory therapists. In some states, phlebotomists do that, but the blood that's coming out of the artery is not the blood we want. The blood that's coming out of the artery is coming from the heart, directly from the heart. So really, all that it contains is gases, um, oxygen, and then any other gases that the person may have breathed in or intake. Um, so the reason for an arterial draw would be to look for gases, like if somebody may have had like maybe carbon monoxide poisoning or something like that. But you're not going to be able to test that blood for anything that we normally test blood for, like cholesterol and things like that. That has to be in the venous blood because that's been picked up throughout the body and is now returning to the heart. So that's why we tend to really avoid the basilic vein. Now, if you are, especially if you're newer to the field, you really want to try and avoid that. Maybe go to the back of the hand before you try the basilic. If you're more seasoned and you feel confident in it, you can use the basilic. I've used the basilic. I still don't like to do it if I can avoid it. But you can also then go to the back of the hand if need be. All right, so steps to drawing blood. First and foremost, we always wash our hands. Then we want to gather up all of our supplies. Take a look at the orders, review the orders, the lab request, so you know exactly what tubes you're using to draw for the various tests that have been ordered. Identify your patient. Apply your gloves. Examine the arms and ask for a preference. Now, a lot of people do have a preference as to which arm they want you to use, or they just know which one works best. Pay attention to your patients and listen to them. They know. Okay. If they say, oh, I don't know, or I don't care, then take a good look. You also want to examine the area too, if there's any, cuts or bruises or, any injury too, you don't want to go there. Once you have done that, you'll apply the tourniquet. And like I said, I am going to have a follow-up instructional video for this that'll actually show you all of this. Then you're going to palpate the veins. So like I said, you start kind of with that median cubital. Then if you're not finding anything there, Go ahead and work your way out towards the cephalic side. If you're still not finding anything, maybe look at the back of the hand, but palpating the vein and what you're really looking for is it's touching it, right? Palpate. But what you're really looking for is a nice bouncy feel to the vein. And when I say bouncy, I mean you push down and you can actually feel it recoil back at you. Um, some people, the vein is right there on the surface. You can see it, but you still want to feel it to make sure it's nice and bouncy. We always go for what we can feel, not what we can see. Matter of fact, when I palpate a vein, I don't even look at the arm. I turn my head, palpate, and then once I feel something that I feel is good, then I look at it. Some people you have to push a little harder because maybe the vein is a little deeper, and that also helps you to kind of get a feeling or a mental map, so to speak, of where that vein is, right? If you have to push hard or harder, it's going to be deeper. If you barely have to touch it and you feel it, then it's right up on the surface. It's nice and shallow. That will help you to determine at what angle you insert your needle. Okay. If it's nice and shallow, you don't have to do, maybe like a 15-degree angle would be fine. If it's a little deeper, you might have to go more 20 to 30 degrees. Okay. Also, when you're palpating the vein, once you find a good vein that you're satisfied with, feel up and feel down on that vein. Because not all veins are straight. Some of them are kind of diagonal. You might feel where it branches off into another vein, and you don't want to go for that because there's a valve there. And if you go to insert the needle and you hit that valve, you're not going to get any blood. Um, so just get, like I said, get a good mental map of where that vein is because we can't see them obviously in the body, and and what direction they run. So definitely do that while you're palpating. Once you've found a good vein, go ahead and clean the site with an alcohol prep pad. Anchor that vein, and by anchor, I mean, and again, I will show you this in my instructional video that'll go along with this. But what I mean by anchor is literally I use my thumb, some people use their index finger, but reach down below where you're going to insert the needle and actually pull down on the skin. It keeps the skin taut and therefore the vein underneath with the tissue underneath nice and taut, and it won't move around on you. Once you're good and anchored and you're ready to go, insert your needle, and you want to do it with kind of a quick motion. You don't have to put the whole needle in. In fact, please don't. Literally like that much of the needle can go in. Again, it depends on how deep the vein is, obviously. But you should never put more than, I don't know, maybe like a third of the needle in, if that. Okay, more like a quarter. And if it's really, really, really superficial up on the surface, you barely have to go past the bevel of the needle, the bevel being the opening that you can see. Once you start to collect the blood by whatever means you're collecting it by, if you're popping tubes on, if you're pulling from a syringe, either way, collect your blood. Before you remove that needle, you're going to want to remove the tourniquet. If you don't, the patient will bleed quite extensively when you take the needle out. Take the tube out if you're using a tube. So if you're using the vacuum method, take the tube out, because if you don't remove the tube before removing the needle, that vacuum will still be vacuuming, so to speak, and you'll hear kind of like a sucky noise when the needle's removed, and that can cause bruising. It's a horrible sound. So just don't do that. So take your tourniquet off, take your tube out if there's one on there. Remove the needle and safety it and dispose it into sharps immediately. Apply pressure with the 2x2 gauze once you have taken the needle out. Please do not push on the area prior to removing the needle with gauze. I see people do that. And you're basically just pushing the needle into the person's arm, and you're risking sticking yourself while the needle's coming out. So please don't do that. Apply the pressure after the needle is out. Totally appropriate to ask your patient to hold pressure for you. And then once you're satisfied that the bleeding has slowed or stopped, go ahead and just take that gauze, that 2x2 gauze, fold it up into a little square, and then bandage it. And then go ahead and dispose of all your other supplies properly as well. So talking about tubes and additives, this is kind of a cheat sheet I made a long time ago. These obviously not all the tubes, but these are the most commonly used tubes. Yellow tubes, or even the bottles if you work in a hospital as a phlebotomist or a lab, are sterile tubes. They have what's called SPS. Um, I'm not going to try and say that because I can't. Usually sodium polyanethyl sulfonate. We'll go with that. SPS. Those are used for blood cultures. So if primarily if a provider feels as though the patient might have a blood infection, so to speak, sepsis, something like that. So not something we typically draw in a doctor's office. It's usually a hospital. Light blue contains sodium citrate. Most commonly used for the light blue are coagulation studies, so prothrombin times for people who are on blood thinners. The red tube has no additive in it. It's the only one that doesn't. That's used for chemistries and serologies. So HIV is tested using a red tube in most labs. That's the other thing. Most of these tubes are used for these particular tests. However, some labs use different ones or use more than one. So you always want to consult that lab's lab manual, or what they call lab directory. And you can usually find those online. You just type in the name of the lab directory, and it will bring it up. And then you can just type in whatever test it is that's being run, and it will tell you exactly what tube to use. It'll tell you whether it has to be centrifuged, how it needs to be stored, if it needs to be refrigerated, which most do. Um, it'll tell you everything about that, which is fabulous. I don't know if they still make them or not. They probably do. We used to have way back in the day lab manuals that were written like in books. Um, and those had the same type of information. However, they didn't get updated as often. The live online directories and manuals, they're updated constantly, so it's really, really helpful. An SST tube, which is either a gold top or what we call a tiger top. Tiger top is the kind of marbled, striped black and red. That is SST, which stands for serum separator tube. That has a gel in the bottom. And these are used primarily for panels and profiles like lipid panels or hepatic panels. Some labs will use the green for panels as well, or they can be interchanged. But the Tiger Top and the Gold are exactly the same tube. Both have the serum separator or the SST gel in the bottom. The light green is a plasma separator tube, or a PST, and that also contains lithium heparin in it. It also has a gel you can see in the bottom of it. The lithium heparin is a anticoagulant, so it doesn't allow for the blood in the tube to coagulate or clot. The green has sodium heparin, again, another anticoagulant. And these are used for therapeutic levels and medications, sometimes profiles or panels. But again, just depends on the lab. The lavender, or what some people call purple, tube is what is known as EDTA. And no, I'm absolutely not going to try to pronounce that. That's the additive in there, EDTA. These are used for anything that has to be tested on whole blood, so not separated. And I'll talk about that with centrifuging here in a minute. But most blood tubes, blood specimens have to be separated out where the serum or plasma is separated from the blood cells to be tested. The lavender tubes are used for blood tests that need whole blood, so not separated. So complete blood counts, platelets, things like that. And then the gray tube has sodium fluoride and potassium oxalate, and those are used primarily for glucose, blood alcohol levels, tests like that. Now, when we draw blood, there is what is known as the order of the draw. You may have heard this term or that phrase. The order of the draw is the order in which the tubes are put on to the vacutainer setup, the hub and the needle, or if you're using vacutainer butterfly, or even if you are going to use a syringe, but then have to use the um, blood transfer device to get it into the tubes. Okay, there's an order for this. And the reason for the order has to do with the additives. Okay, you're not going to switch out a needle every time you have to use a new tube. You're just going to pop tubes off and on that rubber covered needle end of the setup, right? So what can happen is some of that additive, especially the powdered additives, can blow back onto that rubber covered needle, meaning that the next tube you put on, some of the additive from the last tube could end up in the next tube. So they had to come up with an order that it didn't matter if some of the additive from the previous tube ended up into the next tube. So that order, and this is for just the ones we have been talking about, not there's orange tubes, there's pink tubes, there's black tubes. They're very highly specialized testing tubes. These are just your common everyday tubes. So the way it goes is you go yellow, sterile, light blue, red, the SST, which is the gold or the tiger top, the PST, which is the light green, the green, the lavender, and the gray. Okay. Now, you're not going to be obviously drawing all of these tubes every single patient, but say you had to draw, I don't know, a light blue for the various tests, a light blue, an SST, and a lavender. Okay. Those are the tests that are ordered. Those are the tubes that you need to use. You would draw the light blue, then the SST, then the lavender. Because if you drew them in any other order, it could affect the specimen. So if you drew lavender before you drew SST, some of that EDTA that's in the lavender tube mixed in with the SST gel could mess up the results of that particular test that we're using the SST tube. I hope that makes sense. Okay. Now, once you've done this for a while, you will remember the order. It'll just become second nature. Until then, there are ways, little mnemonics you can use to remember. This is the one I was taught when I learned how to do this. I think you could probably go on the internet and find others, or you could even come up with some yourself. But it's stoplight red, stay put, green light, go. Meaning if the stoplight is red, you stay put. Once the green light comes, you go. Sterile, light blue, red, SST, PST, green, lavender, gray. I learned that many, many, many years ago, and it helped me. So, all right, centrifuging. So again, if required, some specimens need to be what we call spun down or centrifuged. This is what a typical centrifuge looks like. The one in your office will be dependent upon, how much you use it. It might be bigger, might be smaller, different brand. But basically, these little holes in here are where you can put the tubes of blood. And then you close the lid. There's always a setting for speed and time, and then you just push start and it begins to spin. When it spins down, it basically goes through these steps. You have whole blood, which is the plasma, serum, blood cells, everything all together. It gets spun and it separates out. And when it separates out, you have your plasma at the top, or your serum, all your blood cells at the bottom, and then every so often you'll see this little tiny line in between called a buffy coat, where the platelets and the white blood cells kind of gather. That's usually not as noticeable as the other two. Um, But this is what a spun down or centrifuged specimen looks like. And then that's how it goes to the lab. A few things to know about the centrifuge and understand. It's kind of like your washing machine in that it has to be balanced. So if you've ever like put your big comforter in your washing machine and it all gets to one side of the washing machine gets thrown off balance and it'll shake and make a horrible noise and like clung, okay? That's what happens in a centrifuge if you don't balance it. So by balance, what I mean is, let's see, two that we can see here. If you put a tube of blood in this hole here and then didn't put anything in the hole directly across from it, it would be off balance and it would shake. And in some cases, and this actually happened to me in my beginnings of my career, it'll shake so hard it'll walk itself right off the counter and crash to the ground. And that actually happened to me. I was in a hurry and I wasn't paying attention. So basically, you need to have a tube of the same size um, on that other, directly across from the one you have, or you can use what we used to call dummy tubes, where you just get several different tubes, and we always kept these by the centrifuge, several different tubes of different sizes with water in them to balance it out. Okay. Um, Very, very, very important. But that is a centrifuge, and that's what those are used for. All right, so that's pretty much all I have for you today. Again, keep an eye out for the follow-up video that I will be making that will actually demonstrate all of this and show you the different supplies and whatnot. But thank you so much for watching, and I will see you again shortly. Take care.